All right, hello everybody. My name is Dr. Goforth. I'm one of the pelvic health specialists at Cornerstone Physical Therapy. I work at our Woodfin location. And today I'm going to be briefly talking about different changes, physical changes that you can expect during pregnancy and a few things you can do to help. So I've got my little cheat sheet here. Number one, constipation. So if we think about the pelvic cavity, your bowl, the organs in there, you got your bladder in the front, your uterus is in the middle, and then your rectum is right behind. So as that baby is growing, baby is literally taking up space. Hence why, one, you feel like you have to pee more often, and you might find it more difficult to go to the bathroom. You might also find that you're a little bit gassier than you used to be. You have a little less control because it's just the baby is pushing on the rectum. So things you can do to help with constipation. Your doctor may suggest taking Miralax if you're noticing that what's coming out is kind of harder or it's just difficult to get out in general, some type of stool softener. So I'm not medically advising on that, so just consult with your doctor or pharmacist about supplements. But of course, fiber is helpful, lots of water is helpful and always a good idea. Those are the biggies you can address through your intake. The other end of things, literally, no pun intended, the muscles called the pelvic floor, some of them go around that most distal end of the rectum and of course right at the anus. That's a muscle itself. So if your muscles are getting tight during pregnancy, which happens sometimes because they're having to work harder to hold that now more weighted uterus up, you can do different trigger point releases to work on those muscles. If you have no idea what I'm talking about, and I would suggest anyway, go see a pelvic health specialist like myself, come here or go somewhere else if you live out of town, but let them teach you how to do some of those trigger point releases to those muscles. It's really simple, but it's too complicated to even get into over a video. Just to keep it brief too. So another thing you can expect while you're pregnant is pain. One of the most common I get is low back pain, or more specifically SI joint pain. Those kind of butt dimples, you could call them if you put your hands on your low back. Those areas that dimple in and are kind of pointy right above your sacrum, bottom of the low back. Sometimes those areas get sensitive. You might notice hip pain as well. You might notice pubic symphysis pain, like in the front, way low at the lower abdomen, pain there. And all of those areas, one thing you can try, there are different pelvic stability belts. If you're seeing a pelvic PT, they can recommend different ones that they've tried that might find helpful. But you can also literally look up some type of pelvic stability belt, and they wrap around the pelvis. So they give compression to the SI joints in the back and the pubic bone in front. So if you're having pain at either one of those areas, that can be a help, number one, especially as you get further along in pregnancy. There's more relaxin hormone coursing through your body, so literally your ligaments are more relaxed and extra stretchy. So that can be a temporary help, but also just being strong. Don't jump into exercising that you didn't do prior to pregnancy, but if you were fairly active, or even if not, doing some gentle strengthening exercises in a yoga or Pilates exercise where it's modified for pregnant women. And again, I would just encourage you to revert to a pelvic health specialist that can also guide you with some of those exercises. But bridges, when done correctly, are really great. You might be familiar with the term clamshells. There's a whole plethora of great exercises you can do. Just for starters, for helping with pain, just to really further support those now extra stretchy ligaments. Moving on, something else that's a biggie. You might notice you didn't used to pee on yourself and now you do while you're pregnant. We already mentioned you might find that you're urinating more often. So I'm sure a lot of you out there, maybe most, are familiar with the term Kegels or Kegels, however you want to say it. That's the first line of defense. It's just strengthening those muscles. If you don't know how to do one, again, go see a pelvic health specialist. 50% of my patients coming in, they do it pretty well. 50% do not, and I don't know what they're doing, but it's not a Kegel, but it's tightening those muscles. You might have heard your doctor say that when you're during urination, if you can stop the flow of urine, that's a Kegel, and you should practice those. And more or less, yes, but I find a lot of people do some extra stuff, which is not so helpful. So I would recommend going to see someone to get just a little more training in that. And then lastly, one of the big ones I just put down, you might notice that you're having some round ligament pain as that baby is growing and those ligaments have to stretch. One of the areas that I check out when I have a female patient complaining about that and she's pregnant is we check out some of the lowest point of the abdomen, those abdominal muscles right above the pubic bone. Now double check with your doctor, especially if you're a high-risk patient. You want to just be careful. They might say, don't touch the abdomen at all. But if you're not, and you've mentioned it to your doctor and they're okay with it, do some gentle massage above the pubic bone where all those abdominal muscles are coming in and attaching at the pubic bone, because the round ligament connects in with some fascia of some of your abdominal muscles. So it's usually a safe bet to massage really low, gently, like right where those muscles attach on the pubic bone. But again, clear that with your doctor. So those are just a few that are really common that I notice with my pregnant ladies, and thought you might find that helpful. So tune in next time, and we'll see you then.